My name is Anissa, and this is my trach care and suctioning video. First, I'm going to do suctioning, so I would first verify the orders that my provider put in to make sure there's no air. Then I'm going to explain my procedure to my patient to educate them on what's about to happen. I'm going to provide privacy. I'm going to perform hand hygiene. After my patient's aware of what's going on, I'm going to raise the bed to the level of my hips. Then I am going to auscultate. Well, first I'm going to put my patient in Fowler's position to prevent aspiration. Then I'm going to auscultate lung sounds to make sure that there's no fluid or anything hurt in the lungs prior. So then I'm going to get my suction kit ready. I'm going to increase their oxygen flow based on like the facility's policy for hyperoxygenation protocol. Perform hand hygiene. So then I'm going to put on my PPE, which would include a face mask, eyewear, just to protect myself. So I'm going to open my suction kit, and I would also pour sterile normal saline into like a saline bin. So I'm going to open my suction kit, and I'm going to don my sterile gloves. So I'm going to grab this, and you have a 2-inch window to open them. These are not open very well. Okay, so now that I've got my sterile gloves on, I am going to take the coiled suction in my dominant hand. With my non-dominant hand, I'm going to turn on the suction device and adjust the regulator to 100 to 120 milliliters of mercury for an adult. So I'm going to dip the tip of the tube then in lubricant, and I'm going to dip it into the basin to flush it and moisten it so it's easier for insertion. So then with my non-dominant hand, I'm going to remove the trach mask, since that's my dirty hand. Then with my dominant hand, with this, I'm going to insert the suction catheter into the tracheostomy until there's resistance or my patient coughs. That's going to indicate that I've gone far enough. Then I'm going to withdraw the suction catheter approximately a ½ inch and then apply suction intermittently and gently rotate the catheter while withdrawing the catheter as well. For each suction pass, I don't want it to be any longer than 10 to 15 seconds. So then you also want to rinse the catheter and tubing by suctioning with sterile saline, and then repeat those steps a total of 2 times to complete the suction process. Once you've done that, you can disconnect the suction catheter from the tube, and then discard of the catheter supplies, your gloves, and perform hand hygiene.